Welcome, everyone. I'm Catherine Lavender, the Data Project Manager for NACDA, and this is our NACDA Data on Aging podcast series. NACDA is the National Archive of Computerized Data on Aging at ICPSR at the University of Michigan, and we're funded by the National Institute on Aging. We seek out and preserve data relevant to gerontological research, kind of like a data library, curating the data as needed to promote effective research use, and we share the data with the research community free of charge. We are proud to say that we are one of the largest libraries of data on aging in the United States, offering opportunities for secondary analysis on major issues of scientific and policy relevance. We hope to connect with the gerontological research community using this podcast series and plan to highlight data resources and researchers, talk through data concerns, and learn the stories behind the projects. Find out more about NACDA and ICPSR by visiting nacda-aging.org. Today, our guest is Matthias Kirch, and Matthias is a Master of Science Statistician Staff Specialist with the Institute for Healthcare Policy and Innovation's Data and Methods Hub, where he is the lead for multiple initiatives, including the National Poll on Healthy Aging. Matthias received his Master of Science in Health Services Research, Policy, and Administration with a minor in Biostatistics from the University of Minnesota and has many years of experience with population-based survey research and demographic data. Welcome. Thank you for joining us.
Thanks. Good to be here.
So we will jump into our questions. Can you please tell us what is the National Poll on Healthy Aging and talk a bit about the central objectives and anything else you want to introduce?
Sure. So the National Poll on Healthy Aging is a nationally representative recurring poll of community dwelling adults ages 50 to 80 in the US. It is directed by the Institute of Healthcare Policy and Innovation and sponsored by AARP and Michigan Medicine. The poll's director is Dr. Jeff Kulgren. Surveys in this poll have gone out twice a year since 2017. They go out to about 2,000 adults every time, with roughly the equal number of people ages 50 to 64 and 65 to 80. The poll vendor that we currently use is NORC's Amerispeak panel, and most respondents complete the polls online. Around 10% complete them on phone, and overall completion rates are over 60% for the poll. The central objectives of the poll are looking at the perspectives of the older adults in the US, to learn about public health initiatives, healthcare providers, policy, and things like that that relate to the health of older adults, the healthcare that they receive, and health policy affecting US adults and their families. So the topics that we cover span a wide range of health-related areas, including medication use, mental health and loneliness, aging in place, and attitudes, experiences, with newer health technologies, such as in-home testing or telehealth. The poll format allows us to look at timely or emerging issues, such as perspectives on the COVID-19 vaccine during the time of the vaccine rollout.
That sounds really interesting. It sounds like you're collecting good information. How do you develop these poll questions?
So we work with IHPI, which is the Institute for Healthcare Policy and Innovation. We have faculty collaborative of over 600 researchers at the University of Michigan. And we invite researchers who are part of this who have an interest in aging or other topics that would impact this population to work with us directly to develop poll questions that they can then use also to inform their own research. So it's a little different from other types of research, right? We're not necessarily looking to do a study per se, or even to replicate measures from previous studies. We're more interested in understanding older adults' perspectives on their personal experiences with healthcare. So when we work with a faculty member, we collaborate. People have a wide range of interests, and that really informs the topics that our polls include. So each wave of the poll that we do has, 4 to 6 topics in it that we ask about, and each researcher can help us develop about, maybe 10 questions for their topic area. And we also include quite a range of questions that we call the health and household, questions, which ask, general health. How is your health? How's your mental health? Who lives with you in your home? Other kind of features about their home that might impact them, their types of health insurance that they have, different experiences like that. We found that the best questions to use on surveys like this are mostly about things that apply to most people in this age range, right? So it's really hard to ask questions that only apply to a very small group of people because we only have a sample of about 2,000. So it's better to ask questions that are things about like everyday experiences or viewpoints on something that might be happening in the news that people can give us some feedback on. Everyone's got an opinion about those things. Answers to questions like these can really help clinicians and researchers to understand what people have actually experienced as it relates to their healthcare, and how likely they are to engage in certain behaviors or talk about their experiences with the healthcare provider. We also find that the best questions seem to be quite succinct, right? Not have a long introduction about a topic that someone's already heard about. Sometimes, some of our best reports have come from one or two questions that we just sort of threw in to see how they would do, and we got some really interesting information back on those. So, that it can be really enlightening just to put out a really simple question, and we've had some really great luck with that. We pre-test all of our questions after we develop them with a sample of about 100 survey takers. So we kind of get a sense of whether people seem to be understanding it, if people are saying don't know, or if there's a multiple kind of response options, we often let them write something in for that one, and we can see if there's any of the choices that we might have been missing from our initial survey question.
Wow. That sounds like a huge network to manage.
Yeah, luckily I don't have to do much of the managing. We have a pretty good team that we all work together to connect with researchers, talk about building questions together, and then just kind of keep the process rolling forward to get the surveys out.
Great. That's great. Yes, working in a team definitely helps in that sense. I am curious about the one or two questions, if you have any off the top of your head that stand out for you, that you were like, oh, that one was a good one.
Yeah, so actually, we were going to talk about some of the major findings, and one of the questions we sort of threw in, this was back in 2018, was a couple of questions about loneliness. We said, how often have you felt isolated from people? How often have you felt that you lacked companionship? And we threw in those two questions to a survey, and we got some really interesting responses. And so we started just kind of continuing with those over time. And, now we really recently, in March, just published a report on, how loneliness changed over the course of the pandemic before and after. And these questions that we asked about, like, how isolated did you feel, obviously became like part of the social vernacular of, social isolation, people were saying. So to kind of see how some of these things changed over time was really, really interesting. And it helped us to see big differences by different groups of people, like people who might have been had poor mental health to begin with, or people who are physically isolated from others, seemed to have a much bigger impact of the pandemic on their mental health and their feelings of isolation.
Yeah, that does sound really important. How about you talk a little bit about some of your other major findings?
Sure. One of the things, although we don't do like a lot of traditional research, we worked with a researcher who wanted to study more about ageism. This idea that, people might experience both internal and external things that are telling them that maybe aging is a negative experience. And so we actually helped her field some questions that became a scale that she was able to use to measure of people's sense of like how much ageism they felt, and over a wide variety of topic areas. But this was mostly like, in your just everyday life, do you see things on the media that tell you should look younger, or do you, how do these things affect you? And we found again, a lot of big relationships between these experiences of ageism and other health related outcomes. So that was another one. And another one kind of related to the pandemic was, early on, we've asked people about their use of some technology to kind of manage their health. So we asked about telehealth in particular. Before the pandemic, most people had never heard of this or never done it, where they had a video visit with their doctor. And obviously we got to know that a lot of people got pushed into that really fast. So to kind of get people's sense before it was really cool, because then we had this kind of like, well, this is what people thought about it before it ever became a real thing. And then this is what people think now. And then, kind of a little later on, once people had more experience, we got some more information about that. And it really helped us have some ideas about who may or may not be more able to access and use these types of services.
Wow, that's great. Yeah, because how fast your internet connection is and all that would definitely affect those telehealth calls and whatnot. Yeah.
And even like things like that maybe you wouldn't even have thought were necessarily connected, but just people who had done things like had ever Skyped with their grandkids or something, they were more likely to embrace a technology like this because they'd had some experience doing something like that.
Yeah. 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 That's a great point. So what about the strengths of this polling? And maybe could you talk about some of the opportunities and challenges of preparing poll questions and using poll data?
Sure. Well, if we start with strengths, I think one of the really exciting things about working on a poll like this is, unlike traditional research, it's very fast, right? So, we work with people to develop our poll questions and get them out in the field within, 6 months. And then we have data, about a month after it's been fielded, and we can start looking at it. So the time frame moves so much quicker than a lot of research that people are used to, and this can be really important for informing kind of policy relevant things that might be coming up. Like if we happen to know that a policy is going to change, or that even though they're discussing it, we can poll people about like what their thoughts on it and have some information to share with those lawmakers as they're debating this. And we have had the chance to do that as well. It's also really, as I was mentioning, you're able to track things over time. And even though this is not the exact same group of people over and over, it's not a cohort, it is, a representative sample of the US population. And so we can sort of see over time, and especially with major, events happening, how people's views have shifted over time. So that's really interesting. And then just being able to have such a wide range of topics that we cover, only needing a few questions about a topic to get a really interesting report out can mean that we get to cover, so many more topic areas. I think we've put out over 50 reports since the poll started,
Oh, wow.
over a wide range of topics. And it just informs like a lot of really interesting and thoughtful ways to engage with people and their health. You also asked about challenges. Some of the things that are the biggest challenges that we've faced so far are that it can be more challenging to ask about things that are not as common to people. So we found this pretty early on, where we wanted to ask about people who had been caregivers to someone with dementia, which, is a fairly common experience for older adults, that they might be in that position to care for a parent or a partner or somebody. But it wasn't very many people. So like, the rigor of the data is not as strong when you only have about 100 people answering a particular question. It still is interesting data and useful and important work, but that's not one of the strengths of the poll. So
Yeah.
one of the things we've done recently is started doing some oversampling of racial and ethnic groups, so that we can have a little bit more information about how experiences might differ by someone's identity, their social identities. But again, we're not able to oversample for every population. So we don't have a great representation across all identities of older adults in the US. And the other thing is, we're working with a lot of researchers who maybe have never done survey research before, who haven't done polls. So just kind of a learning curve of, how do you write a good question? How do you actually get the answer that you're looking for? I see it as both a challenge and an opportunity, because it's an opportunity to really work with someone and develop some questions that maybe haven't been asked of this population before,
Yeah.
and learn some new things.
That's great. Yeah. And it sounds like, it's a valuable resource in a number of ways, both with the output of the data that is produced, but also, working with those researchers to develop those questions, and that's educational. And also it sounds like you can kind of sort of act as a hub for certain questions, which maybe you do develop, but then, you know, you want to reuse, because then you can tell other people to use that same type of question and not remake the wheel, right?
Absolutely. And, that's one of the great things about this work is that we can be really nimble about the results that we share as well, because this isn't tied to any research funding in the same way that a lot of grants are.
Yeah.
So we're able to share our questionnaires with each survey report that we put out. So we share the questions that we use. People feel free to download them, use them for their own research or their own, polls of the community.
Yeah, that's great. So what types of publications have been developed based on these data?
Yeah, so our major publication is the reports that we put out, and these come out about 8 to 10 times a year. We have both the kind of our traditional reports, which are kind of a formatted like PDF style report that might be 2 to 4 pages long. They usually include some infographics of some of the more interesting findings that we had, and as well as some of the data that we found out and some interpretations about how this information can be used by clinicians, by policymakers, by older adults themselves. So these have gone to a wide audience of folks. In addition, we've also done a few what we call poll extras, which are a little more timely even than the poll, where sometimes we get the chance to ask a couple of questions of older adults in a different survey, so like omnibus style. And those we don't usually create a whole report on, but we'll put out a press release that talks about the results of those. So I know we had one that came out, and sometimes we just actually for the extras use other questions that we've already had in our poll, like maybe they were just some of the health and household questions, but we realized, oh, somebody in Congress is talking about this thing. It'd be really interesting to put out a press release. So that's another piece that we do. And we've also published over 30 journal articles. So even though we're publishing this information kind of like in our own format, it hasn't stopped researchers from being able to write, research letters or even initial, like kind of original findings on the results that we found in these.
Great, that's great. And I know you're going to mention the website later, but it sounds really cool. Like who doesn't like a good infographic,
Right.
Okay, so, as we talk about publications and other people using the data, could you talk about what you might recommend to secondary data users of NPHA and what advice you would give to those trying to use NPHA for their own research?
Absolutely. So we were super excited to find NACDA and be able to partner with you to put our data out here, because this is one of the products that we wanted from our research, was that we'd have some data sets available to people who are also interested in this work to kind of learn more about the experiences of older adults, but also, just learn how to work with data. And so we currently have data from our first 7 waves of data on the NACDA website, and we're going to put out another one later this month. And these span from 2017 to 2020 right now. Each data set, like I mentioned earlier, is a discrete data set, so they can't be linked to previous ones. They're not the same people over time, but they each have about 2,000 respondents in them. They're weighted data sets. So this is one of the first big things that, if you're working with survey data, you have to make sure to pay attention in the documentation to which survey weights to use. And I know I sometimes get emails from people who've downloaded this data and they're like, my results look different from yours. And I'm like, okay, well, this is the survey weight we used. And that's usually the biggest question. And they're like, oh, okay, got it. Now it works. So, pay attention to that. But I think, once you have that, they're fairly straightforward to work with. The data is pretty clean. We didn't do any major changing to any of the data. So there are questions where people have, refused or answered don't know, and you get to decide how you deal with that for your own coding. I would say if you're interested in one of the waves of data, one of the best things to do first would be to download the questionnaire or the code book for that and just kind of see what questions we've asked, because like I said, each data set contains about 5 topic areas. And so there might be things that nobody else has looked at because they haven't necessarily looked from one topic to another. You might find interesting connections between some of the topic areas there. And the code book will give you both the weighted and the raw accounts of the data that's in there. So you get a
Great.
sense of like how many people answered a question a certain way. We've also found that these make like really excellent learning tools if you're working with students who are just learning how to do analysis. We've even had one student who's published a couple of things based on, her findings from this. So I think that compared to like some of the like really massive data sets that are out there, these are, bite-sized. They work on like, your regular kind of laptop computer. You don't need a lot of data power to process something, and you can run some pretty interesting analyses and find out some stuff that you maybe hadn't known before. And if you have more information, like you were saying, our website is www.healthyagingpoll.org. There's information about all the polls on there, as well as our reports. And there's a data page that will show you all the data that's available and the topics that are covered.
Excellent. Thank you. Thank you. Yes, we're happy to host the NPHA data and work with you. And it's exciting to see all these data be made available to the research community. Yeah. So, we like to ask anybody working with the data when we have these interviews, the same kinds of questions in general. And it's always fun to hear what people recommend. And particularly for the last question we had, it's consistent across the board to refer to documentation. So I think that's an excellent suggestion, but we get a lot of different answers to the next question, which is what excites you about the NPHA and being involved in this kind of research? And so I'm curious to hear what you have to say.
Yeah, so, my role is a little unique since I'm kind of the data lead, which means I get the really unique chance to work with all of these different researchers, right? So, if we put out 50 reports, I've worked with, probably going on about 50 different researchers, although sometimes we work with someone again on a future one. But I think it's really great. Like there's so many different topic areas that are touching the lives of older adults. And we work obviously 50 to 80. So we're talking about people who are maybe not really thinking about aging yet, but they're getting in that group where, you're starting to think about that. Maybe your parents are reaching that aging group and you've realized, oh, I should start thinking about some of these things. So it's really interesting to see the topics that might impact people. And I just really love that we can be kind of so timely and like learning about different trends, being the person who is in the data first. It's always very exciting to see, whatever we happen to come up with and be part of putting out some really interesting work that I think feels relevant to a lot of people, like unlike a lot of like health studies that come out, which maybe only, apply to a certain part of the population. Obviously, this is older adults, but it affects everyone. Everyone knows somebody who is in this age range and, thinks about their health. And we like to think about health really expansively too. It's not just about like what's happening in your doctor's office, but, how are you preparing food at home? And, how often do you get outside to walk around? Like things that really impact people's quality of life, regardless of what kind of healthcare they have or what, kind of doctors they're seeing. So I think that's a really exciting thing. It feels very relevant and really personal.
Yeah, I agree. That is exciting and sounds very accessible too. I know from my own experience looking at what you all have made available, I do think that it is, I agree with you, very timely and easy to navigate. And that sounds great. And, like you said, health is expansive. And if we're lucky, we're all aging,
Mhm.
there's only one alternative to that. So, but anyway, I think that's all the questions we have for today. And I really appreciate you making the time to talk with us about this. And I think also, like you said, you have a unique role, but I think it's really great for anyone out there who's worked with data or thinking about working with data to be exposed to the various types of roles that are out there. I'm also a data manager, and like you, get experience with lots of different data sets, because we are a data archive. So I think it's important for, people early in their career to kind of know, hey, what's out there? And, there's different things you can do that, are tangential to research. And, also in the wheel of research, but yeah. So thank you
Yeah,
so much for being
absolutely.
here. Yeah.
Yeah, it's been my pleasure.
All right. So thank you again to our guests and to our listeners for joining this podcast. We will share the links to the National Poll on Healthy Aging that we referenced. And you can see all the links. They'll be available in the YouTube description. And if you have questions or ideas, please email us at icpsr-nacda@umich.edu.